So we're eager to be talking about work-life well-being, the latest buzzword in the workplace. The presentation will be everything you may be expecting and some things you may not be expecting. Work-life well-being has many aspects, and we hope as we touch on these today, you will be inspired as we were while researching and preparing for the webinar. Hello, I am Jennifer Kalis, wellness nurse educator and health coach. We all have been adjusting to changes in our work and family lives these past years. Therefore, I'm excited you have joined us for this timely conversation about your well-being today.
And I am Taylor West, Certified Health Coach. Achieving work-life well-being is more than just balancing day-to-day activities and obligations. It encompasses many components that make up an individual's well-being. Stay tuned as we discuss ways to optimize your work-life well-being. Our goal today is to support your understanding of work-life well-being, as well as share strategies you can apply to enhance your work-life well-being. You are not alone struggling to care for yourself, your family, your friends, and perform quality work. This might be especially true if you work long hours. Technology that enables constant connection can allow work to spill into your time at home. Working from home can also blur professional and personal boundaries. So at this point, you may be thinking, I thought it was work-life balance, not work-life well-being. Well, as mentioned before, work-life well-being is a holistic approach on work-life balance that is always changing and evolving. According to the National Institute of Wellness, well-being is an active process in which people gain awareness and make decisions towards a more satisfying, content life. In working towards work-life well-being, you are not working towards a fixed balance point of work and life, but rather growing in your pursuit of overall satisfaction and well-being. What components make up your work-life well-being? Well, let's take a look at the tree. The base of your work-life well-being is rooted in your values, which serve as your anchor point in many aspects of life. Work-life well-being can branch out into areas such as self-management, healthy boundaries, social connections, leisure time, and resilience. Work-life well-being is not the same for everyone, and everyone also goes through different seasons. What different seasons have you experienced? Let's consider a 4.0 college student working their way through school, or the owner of a business that has 2 young children, and lastly, the couple that is empty nesters and work part-time a few days a week. Each of these examples demonstrate different seasons in life. Work-life well-being is taking your season of life and identifying what well-being looks like for you. It is not an elaborate or magnificent process, but rather the accumulation of small steps that contribute to your growth process each day. Please use the chat feature addressed to host and panelists to tell us what is your season of life.
We're just looking for some chat features. There was a few concerns about sound. Okay, you good?
Good.
It seems like those have been corrected. So thanks for the feedback, everybody. So somebody's an empty nester, somebody's a working adult, married with a small child. There's people retiring soon. There's some people in the middle. They're probably a sandwich generation with children in college, working adults. Lots of different seasons of life. Thank you for everybody for your responses. So we're going to go back to the tree illustration, and I'd like to talk about the roots or the values which drive your choices and anchor you. According to LinkedIn instructors Madecraft and Christina Vo, your values are the common thread that blends your personal and work lives together. Neuroscience proves the values or beliefs which matter most to you and are your guide to make sustainable changes for your work-life well-being. Identifying your values can go a long way to uncovering your motivation for change, including your desires, your reasons, your needs, and commitment for change. There are numerous values lists. Some include lists by Brene Brown, research professor at the University of Houston, and James Clear, author of New York Times bestseller Atomic Habits, to name a few. These lists can have up to 120 values. However, for today's presentation, we have chosen a less complex values list from Duke Health Coach Professional Training Foundation course. So I invite you to look at the big picture of your life. What drives your choices, your behavior, your attitudes? Simply stated, what matters most to you? Now, let's look at some of these common life values more closely on the next slide. First, a value for work means you find satisfaction in being a contributing and trustworthy employee. I think of the example, a salesperson values being successful at work and they feel more satisfied with achieving quotas. A value for time with family and friends means building strong bonds with immediate or extended family members and friends. For example, a person may prefer to work 40 hours a week rather than being employed in a job demanding 80 hours a week. Or, if that isn't possible, when they're home, they try to be present and involved with their family. I think of a story about a professional who worked about 10 to 12 hours every day. However, because of his value for family, on Saturday mornings, he would get up, make breakfast for everybody. They would sit down together and talk about each other's weeks, the good, the bad, and the ugly. So the value of health and vitality may become a top value for a person who has a strong family history of heart disease or diabetes. For example, if their father and brother had heart attacks before the age of 45, this person would be driven to try to reduce their risk of having a heart attack by incorporating lifestyle changes and partnering with a health coach. Or if someone is facing a serious diagnosis, partnering with a Connect Care 3 nurse navigator. Service in the community means having a focus on others. For example, there was a mother whose children played on the high school soccer team, so she volunteered. She coordinated rides, meals, and participated in fundraisers. However, when they graduated, she ended her volunteer career and focused on her health and vitality. Living by example means being a role model and positively influencing others. This may be a primary value for a retired teacher who volunteers to mentor children at the local community center. And then there's spirituality or spiritual beliefs. This is a way to find meaning as well as hope, comfort, and inner peace. Some people find spirituality by doing community service or volunteer work or meditation. Others find it through religious practices and belonging to a religious community. For example, a single young adult may say, I think I'll stop going to my place of worship. But years later, when they have children, they decide to regularly attend services again. Values look different at various seasons of life. Valuing being ethical means acting morally such that behavior benefits others and contributes to society. For example, when a nurse's children landed their first jobs and moved out of the house, he decided to volunteer his time working with the state legislature and support ethical issues and support legislation around ethical issues. So now you know how values drive your choices and some of the common life values people hold dear. You may be wondering what life values are most important to you and how they influence your actions and behaviors. Next, we'll look at a simple exercise to help you identify these. I know when I tried this exercise myself and I found it to be insightful and affirming. I hope that you can say the same. This slide depicts a tool you can use to identify your values throughout the different seasons of your life. To discover them, simply follow the steps listed in the slide. And as coaches, we encourage you to not choose what you think the values should be, but what they are, being curious without being self-critical. So 1, think of your happiest times. Consider who you were with, what you were doing, and what factors contributed to your positive feelings and associations. Next, identify the value behind the happiest times. Was it family and friends, health and vitality, ethics, work, spiritual? Next, circle the common life values that stand out to you on this list, and then list them in the order of most importance to least importance. Compare your list of values with the memories of the positive situations and identify where they overlap. This will naturally help you identify your top values. My most important top values coincided with my happiest moments. My health and vitality, time with family, as well as work. I wonder if yours will coincide too. So I'm curious, if you're interested, I'm interested in knowing, what do you think your top value will be? Feel free to add that to the chat feature. And again, it might be hard to choose just one. There's one, family is high up there, isn't it? Yes, we value our relationships and our health. Absolutely. Thank you, everybody.
Throughout the webinar, you will become very familiar with the image of this tree. As Jennifer just explained, the roots of the tree are your values. Next, we will take a look at the first branch of the tree, which is self-management. As we discuss the different branches on the tree, keep in mind how they relate back to your values. Maybe more familiar is the concept of time management versus self-management. So what is the difference? Well, time management is the practice of using the time that you have available in a useful, effective way, especially in your work. However, self-management is action-oriented and is defined as the act of taking responsibility for behavior, health and happiness, and for organization of work activities. Self-management encompasses overall well-being and involves ownership of the hours in a day. Time is a constant variable that cannot be altered or changed. There will always be 168 hours per week, 24 hours in a day, and 60 minutes in an hour. While we cannot alter how slow or fast time progresses throughout the day, we can manage ourselves and the choices we make during the day in that time frame. Have you ever found yourself working on a project that you ran out of time on, or found that there are not enough hours in a given day? A time management perspective looks at how you use time during the day, whereas a self-management perspective reflects on decisions and behaviors that were made throughout the day and establishes accountability for how to complete the task more efficiently next time. So what components make up self-management? Well, skills such as organization, goal setting, time management, self-motivation, stress management, and accountability are all part of self-management. As you may have noticed, self-management includes the concept of time management. However, consider for a moment the many other skills that go hand in hand with time management that lead to self-management. How do you juggle all of the responsibilities and directions that you're pulled on a daily basis? Take a moment to relate back to your values. Values can help guide the choices you make and align your priorities that will point you in a direction to achieving self-management. Next, let's look at daily routines and time allocation. Two assessments that you may find useful in evaluating your self-management include looking at your typical daily routines and your time allocation. These two assessments go hand in hand. Routines can prove to be beneficial or disadvantageous. Think with me for a moment. If a person wakes up every morning and checks social media right away, is this a beneficial or disadvantageous routine? Is the routine of setting out workout clothes as a reminder to work out beneficial or disadvantageous? Reflect on your daily routines. Are there minutes or hours that you can use to improve your work-life well-being with beneficial routines? For example, if exercising or getting more sleep is important to you, are there unproductive routines that you can improve and reallocate your time? Paula Davis, founder and CEO of Stress and Resilience Institute, author of Beating Burnout at Work, stated that the foundation of morning routines can create a sense of accomplishment that carries on over the course of the day. To establish beneficial routines, set aside time for appointments, daily or weekly, and keep these appointments as you would a doctor's appointment. These appointments can serve as time that is devoted towards what supports your values. For example, if you value time with friends, set an appointment on Friday nights to spend time with them. Disadvantageous routines could take away from your work-life well-being. In contrast, beneficial routines may seem insignificant, however, they could have a positive, lasting impact on your work-life well-being. Angela Duckworth, psychologist and New York Times best-selling author of the book Grit, wrote, "Clarity won't give you more hours in the week, but it will help you get more out of your hours." This quote encompasses the concept of self-management and relates it back to your values. Daily life can be busy with unexpected twists and turns that easily disrupt your daily routines and blur the lines of your boundaries. Our next tree branch will cover the topic of healthy boundaries as related to self-management. But first, let's talk about time allocation. And what is an example of a beneficial routine that you do daily? Feel free to use the chat feature to share with us.
I can see, all the different seasons of life that everybody's in, and looking at their values, that some of those routines might really vary, but still be beneficial to them.
Yep.
There's one, exercise in the morning. I like that one myself. Like close out, some quiet time, walk with the dog. What a great way to get
Yes.
out in nature and relax,
Yep.
right, Taylor? Yes. Well, thank you, everybody.
All right, so let's look at Teresa, who is a dental hygienist that works 40 hours a week and commutes 45 minutes each way to work. She prefers to get at least 8 hours of sleep per night. She has expressed that her days fly by and lack time to exercise and connect with her friends on a regular basis. Starting with the larger picture of 24 hours per day, we can work backwards to account for Teresa's daily commitments and routines. As you can see on the slide, we account for Teresa's sleep, her commute, meals, TV, social media, and work. Once all of these are subtracted, she has 1.5 hours left per day that can be allotted to her exercise goals and connecting with her friends. Sure, the other fun daily living activities such as laundry, cleaning, and grocery shopping are not accounted for, but it can still be beneficial to take a step back and reflect on where her daily time is being allotted. Depending on what is important to Teresa, she could manage her time allotments during the day and change her routines to align with her values and current goals. We all go through different seasons of life in which demands are greater in certain areas versus others. While you may not currently have the time you prefer for certain activities, you can always start making small steps towards certain goals.
You know, Taylor, as I look at some other responses, I really see how people are value driven. You know, the time with their family, that value for family and friends, as well as health and vitality.
Yes, absolutely.
Yes.
Our next branch of the tree will cover the topic of healthy boundaries. When you Google search healthy boundaries, the first thing that comes up is in the context of emotional and physical boundaries. Today, we are taking a different point of view and will define healthy boundaries in the context of your daily habits, routines, and commitments. Establishing boundaries can positively benefit your work-life well-being. It is estimated that there are about 200 different types of cells in the human body. A few examples include red blood cells, neurons, skin cells, and fat cells. These cells all work in harmony together to keep the human body running efficiently. They have this capability because they are semi-permeable, meaning they have structure but are flexible for certain materials to enter and exit the cells. Healthy boundaries are similar to a cell membrane because they provide structure and stability in day-to-day life to protect your well-being, helping the various areas of your life live in harmony. Just as work-life well-being is different for everyone, healthy boundaries may be different for each individual. What works for one person may not work for the other. We all may find that healthy boundaries fluctuate based on seasons of life, stressors, situations, and the fluctuations of day-to-day life. Establishing structure around your daily routines can prove to have some additional health benefits. We will look at these next. A lack of boundaries can cause unwanted negative effects and stress in various aspects of life. However, having clear boundaries creates advantages such as stable mental and emotional health, avoidance of burnout, established autonomy, and a positive influence on others' behaviors. Boundaries can help you establish better eating and sleeping habits, improve physical health, and efficiency in your day. As we spoke about before, it's easy for different areas of our lives to start to blur. Imagine the effect of establishing one boundary and how it impacts other areas of your life. For example, creating a healthy boundary around sleep can affect your nutritional habits. Several studies have found that sleep deprivation, which is less than 7 hours per night, can lead to a disruption in appetite hormones that regulate hunger and satisfaction. With a lack of sleep, the hunger hormone increases while the satiety hormone decreases. This tends to lead to the consumptions of foods higher in fat and carbohydrate content. So, by establishing a healthy boundary around your sleep time, you can set yourself up for healthier choices in regard to your nutritional choices and habits. So how do you go about making healthy boundaries? Well, just as a cell decides what comes and goes into it, healthy boundaries are an accumulation of choices made throughout the day of what you will or with the hustle and bustle of everyday life, advancements in technology, and constantly being pulled in different directions, boundary lines can start to blur. Self-reflection and creating beneficial routines can help you develop healthy boundaries in spite of the busyness of everyday life. Once you have identified areas with structured, healthy boundaries and others that could use a bit of reinforcement, you can start to create routines that will guide you in the right direction. Take a moment and reflect on some areas that you already have healthy boundaries established. What areas do you feel could use a bit more structure in your day-to-day life? Routines are actions that are regularly followed, but to break routines down further, they are the sum of tiny habits that are repeated over time. According to James Clear, author of Atomic Habits, a habit is a behavior that is repeated enough times to become automatic. Imagine creating daily habits, which lead to routines, and take the stress out of decisions with day-to-day activities. There are endless possibilities of tiny habits that could have substantial impact days, weeks, and maybe years into your future. Small habits, such as silencing your work email after a certain time in the evening, having a no cell phones policy at dinner, or packing your lunch during the work week can help you establish healthy routines. Establishing healthy routines can lead to healthy boundaries and point you in the right direction toward an improved work-life well-being.
Now, as you talk about healthy boundaries, Taylor, I think of a gentleman who once had a job and he really was on 24/7. Those texts came in at 10:30 at night, at 5 a.m. in the morning, and he got burned out. And then he was able to enjoy a change in his work-life well-being by having a job that was 8 to 5. And he was able to have that boundary between work and home. And he was much more content. As Taylor noted, work-life well-being is a holistic approach to work-life balance. This holistic approach includes your values, self-management, and healthy boundaries. The next component is social connections. And let's look at these through social awareness and self-awareness. There have been various definitions of self-awareness throughout the decades. However, the overarching definition, according to Tasha Eurich, organizational psychologist and executive coach, is that self-awareness has two components, internal and external. Internal self-awareness is how you objectively see your values, passions, aspirations, responses to life, strengths, weaknesses, and how you impact others. It goes to say external self-awareness is the understanding of how others view all these things about you. So why do we need self-awareness? Well, it has been proven to help increase confidence, creativity, communication with others, and work performance. Next, I would like to talk about proven tools available to develop your internal and external self-awareness and impact your social connections. Journaling. Now, if you're thinking journaling is only for teens to help them deal with their large emotions and incredible social dynamics, you are mistaken. Journaling is beneficial at any age. It can help clear your head, make important connections between thoughts, feelings, and behaviors, and reduce your stress, all of which increase your internal and external self-awareness, making a difference in your well-being. There was a study that showed journaling with a focus, such as what went right during the day, what you accomplished, what you are grateful for, produced more benefits than writing about anything in general. So find a space that's free from distraction, find the routine that works for you, writing once a week, going before you go to bed, and start small, maybe 3 to 5 minutes. Build from there. See what happens. You'll be glad you did. And mindfulness. Have you ever felt like your mind is distracted, constantly moving, flustered? Are you like the average American who checks their phone? Listen to this. This is by studies, 80 to 300 times a day. We have busy minds. So it's no surprise that quieting a mind has become essential for social connections and well-being. The quieting the mind frees up mental space to pay attention and show others at work or at home that you care. In fact, researchers demonstrated that mindfulness also increases the ability to manage conflicts positively with better communication. So what is mindfulness? It is simply focusing attention on the present moment without criticism. Excuse me. So some practical strategies. Maybe you like to do yoga or Tai Chi. You could simply focus on the moment that you're in while you're out walking or you're eating or playing with a child. There's apps like Headspace or Calm, and there's deep breathing. And we're just going to take a moment to try this. I invite you to join me to make yourself comfortable in the position where you are. You can close your eyes or open your eyes and just notice your breathing. Don't change anything. Just notice the sensation of the breath in and the breath out. As you exhale, you release tension from your body, allowing for an even greater sense of relaxation. Now, to go a little bit deeper, I'm going to ask you to breathe in deeply through your nose and feel your lungs expand. We're going to pause and hold that breath, and then breathe out like you're blowing out birthday candles. Let's do that again. Breathe in deeply and feel your lungs expand. Pause and hold. and breathe out forcefully through your mouth, like you're blowing out birthday candles. Oh, thanks for joining me in that simple breathing exercise. This is a tool you can begin using today. Try it before a meeting and see how it affects your ability to focus. Another tool for developing self-awareness is feedback. According to Tasha Eurich, getting feedback enables you to understand how others see you. Her research shows that people who know how others see them are more skilled at showing empathy and taking others' perspectives, skills essential for strong social connections and resilience. However, she does caution, it's best to seek feedback from friends, colleagues, or family members who have your best interest in mind, people who are willing to tell the truth and do so with kindness. So just as self-awareness enhances your social connections, social comparisons and the excessive use of social media can diminish your social connections. Let's look at these two barriers and watch out because here comes the gremlin. If you attended other Connect Care 3 webinars in Wellbeing, you may have met this menacing gremlin. This is your inner critic. It tries to convince you that you are not enough. Your gremlin can definitely sabotage your work-life well-being. And often there is more than one gremlin. Gremlins are everywhere. And Taylor and I want you to be prepared for them. So the two I'm going to talk about today are social comparison and social media. You are not alone if you find yourself caught up in social comparisons. While preparing for the webinar, I was surprised by the research. It showed that we spend as much as 10% of our thoughts every day comparing ourselves to others. The comparisons often revolve around wealth, intelligence, attractiveness, and success. And when you compare yourself to others, there will always be someone with more or less money, more or less intelligence, or more or less followers on Instagram. I think we can all agree social comparisons can be dangerous or helpful. On a positive note, you might experience motivation to change a habit when peers push you to do so in a friendly, competitive way. So you decide to walk with your neighbors 2 evenings a week because you don't want to miss out. On a negative note, social comparisons can be dangerous when they breed insecurity, jealousy, self-criticism, or arrogance and overconfidence. Next, let's look at the gremlin, social media, and how it affects our well-being. The truth is, the results are mixed. On one hand, social media can build a sense of connectedness when celebrating with friends or finding a solution to a problem. On the other hand, it can diminish self-esteem, increase the risk for social anxiety and depression. The researchers who have studied the effects of social media have concluded moderate use is fine, but in excess, it can increase social comparisons and lower one's physical and mental health. The truth is, the hidden gremlins of social comparisons and social media will never go away. However, with your self-awareness, you can mitigate the dangers of these gremlins and enjoy a sense of contentment. The next slide offers strategies to silence them and build meaningful social connections. As mentioned previously, self-aware people understand their internal world and their impact on others. This in turn increases their social awareness and leads to an increased ability to empathize with others, as well as demonstrate kindness and gratitude. So let's look at these a little bit more closely, empathy and kindness. Gratitude, I'll talk about later in the presentation. Let's be sure we are all on the same page and agree on what is empathy. By definition, empathy is looking outward and understanding and appreciating others. Neuroscientists have discovered everyone is wired for empathy. Bill Drayton, the renowned father of social entrepreneurship, believes that in an era of rapid technological change, mastering empathy is the key business survival skill because it underpins successful teamwork and leadership. Consequently, it goes to reason that if this is essential at work, then empathy is just as essential at home. Now, if you're concerned that you're not empathetic enough, no worries. This skill can be cultivated. To cultivate empathy, notice facial expressions and body language to help you better understand the emotions of others. Be curious. If you notice a coworker or friend or family member seems a little off, let them know you noticed. And if they want to talk about it, you're available. And then if they do talk about it with you, try listening without interrupting or offering advice. Another way to develop empathy is to start a conversation with someone different from you and cultivate your curiosity. Maybe you'll talk with the employee who sits alone in the cafeteria or speak with a niece or nephew who looks unhappy whenever you see them. I think of the team here at Connect Care 3 as we practice empathy with our patients. We recognize that everyone has different experiences related to their health, their lifestyle, and health goals. So we cultivate our curiosity, listen hard, and put ourselves in our patients' shoes to understand them, their concerns, desires, challenges, and goals. Next, let's talk about kindness. Kindness is another strategy to build social connections, and the benefits are exponential. The benefits are not only for those who perform the acts of kindness and those who receive those acts of kindness, but those who witness them as well. According to a study at the University of British Columbia, a group of highly anxious individuals performed at least 6 acts of kindness a week. After 1 month, there was a significant improvement in their mood and less social avoidance in the highly socially anxious participants. There's also been research that has shown that perpetually kind people have 23% less cortisol, the stress hormone, and age slower than the average population. I'm curious, did any of you see some acts of kindness today, or were you the recipient of them? Feel free to let us know in the chat feature. And as you do that, Taylor's going to talk about the next branch, leisure time. What a fun topic. Take it away, Taylor.
So far, we have covered self-management, healthy boundaries, social connections, and now we will look at leisure time. Do you know what fills your cup or brings you joy? Maybe this topic will help you branch out and try new activities in your leisure time. With the daily stressors of life, we all need time to relax and recharge. This can look different from individual to individual. One person may enjoy sitting at the local coffee shop on a slow Saturday morning, while another may enjoy going on a long hike with friends, or the other may enjoy cooking classes. By prioritizing leisure time into your daily routine, you can potentially see health benefits such as improved heart health, better memory, healthier immune system, and enhanced ability to manage stress. Additionally, research suggests that individuals who experience positive emotions such as joy, happiness, and excitement live longer, healthier lives. Engaging in fun activities releases endorphins, which are feel-good messengers within the body. Endorphins are capable of creating an overall sense of well-being and in some circumstances relieve pain. Leisure time can boost energy and vitality while increasing resistance to disease, helping you function at your best. In the words of George Bernard Shaw, we don't stop playing because we grow old because we stop playing. Depending on the season of life, you may have varying amounts of leisure time. Fitting leisure time into an already busy schedule can seem daunting, but there are a few ways to add it to your routine. Just like we assess daily routines around establishing healthy boundaries, a routine assessment can shine light on areas that can potentially be reallocated to leisure time. When trying to implement leisure time into a busy schedule, reflect on the value of your routines throughout your day. For example, some people may enjoy watching TV and value that as their leisure time, while others may value spending time outside with friends and family and be able to reallocate their current TV time to an area of leisure time that better serves them. Another way to incorporate leisure time into your daily routines is by making self-appointments. As we talked about before, these self-appointments are time that is set aside monthly, weekly, or daily for leisure time. Setting this time aside can create an opportunity to de-stress from work, be creative, or have fun with your friends and family. Self-appointments can look different for each person, but treat them as an outstanding appointment and one in which you wouldn't cancel unless absolutely necessary. Lastly, social connections can provide an accountability partner for leisure time. Making appointments with friends to go for a walk in the park, bake, or go for a run can help preserve your time that you have set aside for what fills your cup.
Taylor, this reminds me of a woman I was chatting with. She was a business owner and she worked and she worked. And after some conversations with her family, setting some healthy boundaries, a value for leisure time, they set appointments to take a weekend trip every couple of months. And she found that she was happier. She was more satisfied. And all of a sudden she started sleeping better. She was less stressed and began exercising too. You know, there was that spiral upward from one good choice, one healthy choice.
Yeah, sounds like she found what worked for her and it was multidimensional for sure.
Yes. So let's go ahead and talk about resilience, the last branch of the tree that we're going to talk about today, and then we'll put it all together for you. Resilience includes physical as well as mental and emotional resilience. According to the American Psychological Association, resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. As much as resilience involves bouncing back from these difficult experiences, it also involves personal growth. In other words, the definition implies there will be adversity and tough times. However, with resilience, there is the opportunity to emerge from these more confident and more courageous. Looks like there's been a lot of kindness, a lot of fun things going on and kind things. Thank you, everybody. So before I speak about physical resilience, it's time to stretch. One of my favorite stretches is the overhead and front stretch. So I'm going to ask you to join me. Please feel free to stand up or remain seated wherever you are. Please interlace your fingers with your palms turned upwards above your head while straightening your arms. We're all going to do that right here and stretch ourselves. Remember to deep breathe when you do this. Lower those shoulders though. Now, lower your arms to the front, parallel with the floor, your fingers laced with your palms facing away from you. Stretch at the shoulder level. Hold that. Remember to breathe. You can even kind of lean to the left and lean to the right. Well, that feels better. I hope you feel better too. Thanks for joining me. Building your physical resilience is essential to your work-life well-being because a healthy body provides the energy and physical stamina to respond to adversity and trauma, threats, and stress. It also decreases the risk for anxiety and depression. The aspects of physical resilience include physical activity, healthy eating, stress management, sleep, and all topics health coaches are trained to address. So physical activity. Our patients tell us that when they're exercising, they actually have more energy, they sleep better, feel more confident, their aches and pains are less, and they realize that they have momentum, which builds their values for health and vitality. If you want to know more about exercise, I invite you to go to the Connect Care 3 website. Click on our resource tab and search under Wellness and Webinars. There are webinars on the importance of resistance training, as well as some other ones if you want more information on exercise. And healthy eating. This is another aspect of physical resilience. Not only does good nutrition provide your body with essential nutrients so you can perform optimally, it also promotes a healthy immune system and provides you with energy when facing adversity and stressful situations. Now, healthy eating is a broad topic. So again, if you want to learn more about transforming your eating habits, I invite you to go to the Connect Care 3 website. Click on the resource tab for nutrition education, articles, and webinars by our registered dietitians. There you will find webinars such as on nutrition topics and a grocery store tour. And stress management, that is also key to resilience. Now, stress, it is a natural, even necessary part of life. It can be physical, mental, or emotional strain caused by the perception the demands placed on you are greater than your resources to manage it. Now, everyone responds to stress differently. You may notice, do your muscles tense up? Do you feel panicky? Or are you sleepless? Maybe you get irritable or feel like the whole world is resting on your shoulders. No matter what is your response, it's important to understand why you are feeling stressed and develop strategies to foster relaxation. Sometimes a simple deep breathing exercise will focus your mind so you can problem solve and ease your stress. Taylor and I have noticed that when our patients have regularly exercised and done physical activity, their stressors seem to impact them less. Restorative sleep is also important. I'm sure many of you are aware of how sleep changes with different seasons of life. You may be a parent of young children, as some of you said, or of an adolescent and your sleep is definitely limited. Or maybe you are older and need less sleep, or you're very stressed and it's difficult to sleep all night long. There's so much on your mind. So that's on one hand. On the other hand, I'm sure you all know how wonderful a good night's sleep is. Your thoughts are clear and you feel like you could conquer the world the next day. Again, building your physical resilience is essential to your work-life well-being because a healthy body provides the energy and physical stamina needed to respond to the adversity, trauma, and stress. Is there anything you'd like to do to foster your physical resilience? We're also going to talk about mental and emotional resilience. There are many resources available to bolster these. Today, the list on the slide is recommended by the American Psychological Association. Perspective is everything. There might be days you're struggling with a situation and are thinking, I'll never get through this. But you could remind yourself, while this is difficult, you've struggled with a similar situation and you were able to navigate through it. You learned you were stronger than you knew, and you can do this again. So again, you also learned from your past experience. We also know that change is inevitable. There'll always be changes and seasons. Some you choose and some you don't choose. Accepting what you can't change will enable you to focus on what you can change. So the question is, what is one thing I could focus on that is in my control? As noted by James Clear, you can't control your feelings, but you can control being kind. There's also gratitude. We'll talk about this in just a few minutes. And being hopeful. I think of the day when, oh my gosh, I spilled the bottle of milk all over the kitchen floor, and then that was just the start. I had trouble with my car as well, and I thought, oh, my day is going to be terrible. But you know what? I can say, oh, it started out terrible, but it doesn't mean it will be a terrible day. It can get better. There's also sometimes a need for professional help. Sometimes the weight of life events and stress just gets too heavy to carry alone. If this happens, you may want to consider speaking with a professional counselor. Not a single person with whom I've worked has regretted connecting with a counselor during challenging times. These professionals have tools to help you gain strength faster than you could on your own. So, neuroscience has proven the value of changing perspectives and gratitude to bolster mental and emotional resilience. Let's look at these a little bit more closely, and that's some guides that you can use to facilitate a change in your perspective when needed and incorporate gratitude into your routines. Did you know perspective is everything? I see some people, they have some things they're going to do to help foster their physical resilience. Just backtracking for a moment. Exercise. How do I manage my stress is one of those questions too. So let's look at changing perspective. This is an activity. I'm going to give you two perspectives, number 1 and number 2. I'm going to ask you to tell me which person do you think will move through the challenge of losing a job faster. So the first person, their perspective when they lost their job is, I've lost my job. I'm never good enough. I will never get another job. I am useless. Or person number 2 and their perspective, they're thinking, I'm disappointed I lost my job. This is challenging. However, I am capable and will find a way to get through this. Person number 1 or number 2, who do you think will move faster through the challenge of a job loss, even though it will be challenging? You got it. Let's go for the 2s. The only difference between the two scenarios is the perspective and the interpretation of the situation, not the situation. Both lost their jobs. Now, many times, that first reaction, that person number 1, is an immediate reaction. And it's true, we can't always choose our immediate reaction. However, we can give ourselves space, take a deep breath, practice self-awareness, and consider a perspective that supports your well-being. Perspective can mean the difference between being stuck and feeling hopeless or moving forward optimistically. So there's a strategy by Dr. Beth Kerlin. It's notice, become aware of the situation at hand, what's happening and why, and what's your interpretation. Accept how you feel about it. It's okay to feel angry, sad, anxious, or frustrated, to name a few emotions. Positive psychologists have proven being honest about emotions is actually less stressful than denying them. So it's important to acknowledge them and also differentiate them between what's actually happening. Then you're going to inquire, is there another way I could see the situation? How would other people perceive this? Is my reaction amplified because I haven't slept well and I'm hungry, I'm stressed? What's a more accurate perception or helpful perspective? And then you're going to shift your focus. What's a new alternate narrative? This shift in your thoughts is not designed to ignore the reality of the situation. Rather, add another perspective, a more hopeful one that supports your well-being. And I suspect as you shift perspectives, your body will feel more relaxed and your mind more focused. So summing it up, it's notice, accept, inquire, and shift. This is a strategy you could begin to use today. You'll be glad you did. We also want to talk about gratitude. At its most basic level, it is simply reflecting on the good things in your life. It can be practiced anytime, anywhere. It's free and only produces positive effects. Now, I want to be clear, gratitude is not intended to deny life is hard. Rather, gratitude is designed to help you more deeply enjoy good times and manage tough times with resilience. It provides the opportunity to pause and realize there is good around you each day. Now, it may be challenging to find the things that you're grateful for on difficult days. However, it can add joy to your life and improve your sense of mental and feel grateful, as well as a decrease in that stress hormone, cortisol. Remember, this is what we talked about when we did the acts of kindness, those changes in hormones. And this can happen whether you performed the act of kindness, witnessed it, or were the recipient. Another study from the University of California, San Diego's Empathy and Emotional Lab, gratitude at work buffers stress, builds confidence, and reminds people they are valued. They also concluded grateful people appear more competent and warmer than those who don't. I think we all like to appear more competent, don't we?
Yeah.
So you can do it. Add a practice gratitude to your routines and bolster your mental and emotional resilience. Before long, you'll notice your improved mood, calmer mind, and stronger relationships. And next, Taylor's going to put this all together for you, and we'll have a time for question and answers and a brief review of Connect Care 3. Taylor?
Thanks, Jennifer. So you've gained a holistic view of your work-life well-being and know how values anchor you and can provide a map to enhancing your well-being. You're in the driver's seat. Maybe you had an aha moment during the presentation or a strategy grabbed your attention and you want to practice it. You have options to care for yourself. As we have spoke about previously in the presentation, the concept of work-life well-being is not black and white. Everyone has different aspects of their work-life well-being and they want to enhance. And you may be thinking, where do I start? One starting point may be to go back to your roots and think about your values and what is important to you. From there, pick a branch on the tree that you would like to work on. You may find that as you start enhancing one area of your work-life well-being, that it positively impacts other areas of your life as well. As health coaches, when clients are navigating the goal-setting process, we like to refer them to SMART goals, which we will explore next. Just like the slide indicates, you need to be smart when establishing goals. SMART goals take a larger, more generic goal and break it down into smaller, achievable steps. So when you're creating a SMART goal, ask yourself the following questions. How can I align the goal so it is specific? What unit will I measure? How attainable is this goal for me? Does it help me take a step towards my larger goal, hence its relevance? And lastly, in what time frame would I like to achieve this goal? So let's take a look at the SMART goal examples on the slide and give you ideas of how to enhance your work-life well-being. So from this, the more generic broad goal of I will have a better work-life well-being to I will evaluate my daily routines and compare them to my values on Monday. Or I will regularly practice the NAIS technique for 1 month. Or lastly, this month I will put away technology devices when eating meals. When thinking about routines to enhance your work-life well-being, James Clear offers great encouragement. Improving your habits by 1% every day will yield remarkable results. When you commit to creating small habits, you experience the compounding beneficial effects over time. Next, we would like to remind you about Connect Care 3 services. After this, we will have a Q&A session and hope you're able to stick around.
So Connect Care 3 is a service provided by your employer for the employees and their dependents who are covered by the health plan. There is no cost to you. You will never receive a bill for any Connect Care 3 service. It's also confidential. Everything shared with our nurses, health coaches, and registered dietitians is kept completely confidential. And Connect Care 3 is independent from providers. This means we are not affiliated with or receive payment from hospitals, insurance carriers, or doctors. And Connect Care 3 is a voluntary service. You'll never receive a call unexpectedly from Connect Care 3. You initiate the process. So how does this process work? First, you reach out to Connect Care 3 and you'll have contact with a patient advocate. The patient advocate will complete a brief intake assessment to gain a better understanding of your needs and have you fill out our consent form. These forms are straightforward and will not take more than 5 minutes to complete. Once the forms are submitted, you will be assigned to the Connect Care 3 line of service best suited to your needs. So you see our multidisciplinary team, patient advocates, they provide clinical research and provider resources. Nurse navigators, they identify well-credentialed physicians for second opinion options and the most up-to-date treatments. They help patients understand their diagnosis and treatment plan and prepare questions for physician appointments. Our chronic disease management and prevention team is compiled of registered nurses, certified health coaches, and registered dietitians. They work together to help patients create sustainable and healthy lifestyle changes to manage and prevent disease. And then there's nutrition education. Our registered dietitians help patients understand the connection between diet and health by providing nutritional assessments and providing education on healthy food choices. Our tobacco cessation program, this is where our clients work one-on-one with our certified tobacco cessation coaches to achieve and maintain a tobacco-free life. So we are all here as a multidisciplinary team of patient advocates, nurses, health coaches, and registered dietitians working together to ensure that you have your needs met throughout your health journey. We also are offering, as you can see, these is our wellness topics for the remainder of the year. This is today's webinar. In August, in September, and November, there will be information on sleep and well-being as well as nutrition. In October, we have a webinar called The Season to Be Healthy. I'm excited to hear what that's going to be like.